This episode of Coronavirus North Carolina News Brief is brought to you by Right By You Mortgage. Wherever life takes you, we're right by you. Visit rightbyyoumortgage.com/podcast to learn more.
From WRAL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Wednesday, September 23rd, 2020. I'm Brian Schrader. North Carolina could enter the next phase of reopening as soon as next week. One of the many headlines from the governor's briefing on Tuesday would allow stadiums and outdoor venues to open at 7% capacity beginning October 2nd. A final decision on that would come next week.
We share this news today so those outdoor venues with seating capacity of more than 10,000 can begin preparations that are key to safely reopening their doors to have a limited amount of socially distanced fans.
There's also a new app meant to help with contact tracing. Dr. Mandy Cohen says the COVID NC app uses Bluetooth to let users know if they've been in contact with anyone who's tested positive. It does not collect your personal information. Also on Tuesday, the acting deputy secretary with the Department of Veterans Affairs traveled to North Carolina and met with staff at the Durham VA. Pamela Powers wanted to learn more about how they've operated and helped veterans through the pandemic. She spoke with WRAL's David Crabtree after the tour.
Ms. Powers, thanks for taking the time to talk with us.
It's my pleasure to be here.
How do you capture what's happening there at the Durham VA?
This pandemic response from the Department of Veterans Affairs has been incredible, and it really is a story that hasn't been told yet. And I've seen resilience in our staff, similar to the resilience that our veterans display every day. And I've seen the courage in our staff as well, and the innovation. The things that we did in this department early on really set the stage. We early on stood up a command center, managing, tracking the system enterprise-wide. We limited our visitation to our facilities early on, especially in our community living centers, which are our nursing homes. We are experts in infection control, and so we've not only had a great response internal to our VA system, but we've really been a best practice and shared those practices with the entire nation.
As we have been in this now for some 6 months, we have the great benefit of hindsight. We can say, well, had we known this, we could have responded this way. As you look back on this now, even though you're very proud of what's been done, is there anything you might have done differently? What has the VA learned from this experience so far?
So there's a lot of lessons learned. But the one great thing about this integrated system of care that we provide, we have 170 hospitals around the nation. We were continually learning and continually innovating throughout this process. Early on, PPE, protection equipment, was scarce around the entire world. And our logistics system that worked in the past didn't necessarily work in that environment because it was so scarce. So we really had to find new ways of getting that equipment. Now we're building that infrastructure for any thing that comes our way. But we've learned a lot of lessons along the way, and we've shared it not only throughout our system, but to the entire nation. Our 4 missions in the Department of Veterans Affairs are health, benefits, memorial affairs, and the 4th mission is serving as a backstop to the national healthcare system in times of emergency, natural disasters. We're really good in the hurricane response side, especially here in the North Carolina region. But we've never had to deal with this on a national level. So we had to innovate and transform as it was happening. And it was really interesting to see this organization transform daily. We had to build capacity in our system. We built about 30% in our ICU and our med-surg beds across the system. We hired over 40,000 personnel, 8,000 of which were nurses across the system, to not only do our internal care, but to help the nation. And so we've really had to expand and prepare for our support here in VA, but also to support the nation.
It sounds like, from your perspective, you are prepared for a second wave if it happens.
Most definitely. We continue to analyze this. We've got a lot of focus on areas around the entire nation. We're continually monitoring where we're at, surges in different areas. And another great thing about our system, because we're integrated, is we've been able to shift resources, supplies, and personnel where needed and when needed. And one thing also that I would like to mention is we've stood up centers for our supplies. We've built capacity in our supplies, so we're ready for anything that comes our way as well.
And that's your Coronavirus North Carolina News Brief for Wednesday, September 23rd. Let us know what you think of the podcast. Leave a rating or review wherever you listen, and be sure to subscribe so you don't miss a new episode. From WRAL News, I'm Brian Schrader. Thanks for listening.
When it comes to buying a new home, you want to know that you're in good hands. At Right By You Mortgage, the dedicated team of lenders live in your community and are committed to being right by you every step of the way. Whether you're a growing family, a relocating professional, or a retiring couple, they'll partner with you to find the right loan to fit your unique home buying needs. Plus, with the Right By You Mortgage on-time closing guarantee, they'll pay you and the seller $500 if you don't close on time. Visit rightbyyoumortgage.com/podcast to get started. Wherever life takes you, we're right by you. Go to rightbyyoumortgage.com/podcast for full details. Equal housing lender, NMLS number 402136.